The Global Surgery Lab presents Psoas Hitch and Ureter repair. The goals of this video are to identify indications for a psoas hitch, demonstrate an approach to this procedure, and to outline the key principles of postoperative management. The goal of the psoas hitch is to restore ureterovesicular continuity. Indications may include ureteral obstruction, fibrosis, or stricture, and are often secondary to surgery of the lower abdomen. To perform this procedure, you will need a knife, long-handled Metzenbaum scissors, retractors, forceps, needle driver, suture, Foley catheter, and ureter stent. Remember to follow all safety protocols and best practices. The general steps to the psoas hitch and ureter repair include 1. Prepping the patient by inserting a Foley catheter and completing an incision to visualize the bladder and ureter. 2. Mobilizing the bladder and creating an incision in the dome. 3. Removing the damaged portion of the ureter and attaching distal healthy ureter to the bladder wall. And 4. Hitching the bladder to the psoas muscle and completing the soft tissue repair. To get started, place the patient in supine position, insert a Foley catheter, and make an incision to visualize the bladder and ureter. Please note that a lower midline incision is indicated for this procedure. However, an extended incision is shown in the video for better visualization for the audience. Next, mobilize the bladder and ureter. It may be easier to mobilize the bladder if it is inflated with saline. Create a 4 to 5 cm oblique incision in the dome of the bladder so that a portion of the bladder wall can be stretched to the psoas muscle without placing tension on the bladder. Please note that the incision shown in the video is larger than necessary to aid in visualization for the audience. Next, remove the damaged part of the ureter, ligate the distal ureter stump, and attach the distal end of the healthy ureter to the bladder through a small incision in the bladder wall. You may spatulate the ureter to make the fixation easier. Position a stent through the ureter into the bladder to prevent postoperative obstruction. In this video, we attach the ureteric stent to a Foley catheter so that the stent can be removed by pulling on the catheter. Alternatively, the stent can be attached to a string that hangs into the bladder and removed using cytoscopy. Finally, attach the bladder wall to the psoas muscle approximately 2 to 3 cm above the branch of the common iliac artery using 3 sutures and complete the soft tissue repair. The stent should remain in place for at least 14 days and can be removed once the ureter can maintain patency independently. In conclusion, psoas hitch and ureter repair can be used to repair injury or obstruction of the distal ureter.